Hi, welcome to Dr. Robert Moultrie, King Docs, a Wealth of Health channel, where you'll get a new perspective on health and how to approach all your healths in mind, in body, in relations, how to stay well or prevent an illness or improve upon illnesses or just improve your health overall with new strategies. Please like, subscribe, and share. Greetings, great world. Hi, my name is Dr. Robert Moultrie. How are you doing? Awesomeness. I know we're going through a big challenge right now. It's called the coronavirus. I want to share with you my very firm suggestions on how to approach this. And this is suggestions at all levels, from individuals to hospitals to doctors to World Health Organizations. Um, Yes. Uh, the guide to me has been AIDS. AIDS, the guide to how to approach viruses, but not only viruses, but all diseases, how to approach them, what lessons have been learned from AIDS. So that's going to be my suggestive approach. I'm not, don't, I dare you, not to be ignorant and just assume that I said do the same thing as AIDS. No, it's not quite the same thing. But one of the things that AIDS has assisted humankind in doing is approaching health with principles. Many of us may not have listened to that for various reasons, and I'll be blunt about it. Um, One of the lessons of AIDS was to self-reflect on arrogant medicine. And some of us have, and some of us just repeat the same thing. Okay, and we're going to get the same results. All right. All right. There are many different lessons out of AIDS, but one of the lessons of approaching health with principles, and I want to start with this one thing to help understand some things about viruses or disease in general. Even though this is circulating around the coronavirus, which is happening right now, but um, based upon what I sense, what I feel, how I understand, the lessons I learned from AIDS, is there's going to be more. There's going to be something different. Okay, there's going to be more deleterious, etc. This is very serious by itself. I can't tell you on data, etc. How serious it is, but I operate on other things that the AIDS virus has told me to operate on. Intuition, which is what a doctor is all about, which we really have tried to take out of medicine and doctoring. But in any case, um, this one sentence is a phrase, is a place to get started. Words and concepts of approach make a big difference. Many are saying this about this virus and diseases in general. I hope not to get this virus. That's one big conceptual thinking. Others are saying, I hope not to get the disease that this virus causes. That's another level of consciousness and understanding about diseases in this virus. And another one is saying, I plan not to get the disease if I get the virus in my body. That's a whole nother level of things. This beautiful, yes, I'm going to say some strange language to you, but this beautiful gift called AIDS has taught us how to approach this called coronavirus, as well as other viruses, to understand that there are many different aspects to, well, in this case, we're talking about virus, but many other things that go into our body, okay? One is, let's take our time. One, the body is in the virus is in the environment. It's in the environment, whatever that means. Whether that means air, whether it means something to touch, whether that means sex, whether that means through our blood, however different means that different things may enter our body. Okay. Now this people are observing. A lot of people think that it is through touch mostly, And yes, it is. I would surmise it too. I'm going to tell you right now. Uh, I have not, I, I have not come in contact to a diagnosed coronavirus patient yet where I'm at yet. So far, we have in this country 2 to 7, but I know how things work, and it's more than that. We're just not diagnosed yet. In other words, means around the country, it's just not diagnosed yet. Around the world, it's not diagnosed yet. But um, one is it's in the air. It's in the place where it can be picked up, whether it's on somebody, whether it's in the air, whether it's on something physical, or the other means that I said. It's out there. It's not in you yet. So that's one. Two is somehow it is on you. Okay, maybe it's on your hands. Okay, in this particular instance, we're emphasizing a lot about physical touch. So it's in your hands, or um, anything that has a cough in it. My great friends around the world, my great doctors around the world, if it has a cough in it, it is going into the air. The viruses, whatever's going in from a cough up to the lungs, is being spewed into the air. Okay, if it's in the air, you will breathe it in. So I'm not gonna buy into the quick surmising from other viruses, etc., that this is just one mode of it going into it, which is high with this high degree of infectivity that it has. Okay, so I say let's leave ourselves open in this early stage to many different mechanisms and means. Okay, before letting our guard down in different ways. So let's say it does get in, whatever means and ways that it gets in. A virus is in the body. I'm going to ask the question that I often ask is, the virus is in the body. Do you have the disease? That's an important question to ask. The virus is in the body. Do you have the disease? The virus is in the body, yes, but it does not automatically mean that you have the disease. So the virus just entered the body just now, and now it's going to try to have an effect. It's going to try to have its effect of what it is to do to the body. Okay? That's significant. It's going to try. Okay. Now, there are a number of people who have the virus that's in the body, and they have an effect. It has an effect. Then there are a number of people who has it in the body, and it has varying degrees of effect. A small effect, then those with this effect, a little bit bigger effect, and then some with bigger effect, some with bigger effect, and some with a huge dramatic effect, some with eventually unfortunate with death. All of those are significant. All of those are significant. All of those are significant. So what we want to do is not only study the sick and not take a look at the sick, but you also want to see, what are some of the characteristics of those that have not had the sickness, and how do I get sick? Very important question in health. How do I get a particular disease? It's a very key question. Why? Because if you can identify the many different factors, and that's right, every disease has many different factors, then you could start correcting each one to decrease your risk of having a problem with the disease. That's another set of language that I'm using right there. That no disease is caused by one thing. No disease is caused by one thing. So colds and flus, for some reason, I don't know, a lot of people say it's due to viruses. Okay, that's another level of things. But cold-like symptoms can be caused by other things. For me, sometimes if my vitamin D is low, may get symptoms that mimic cold-like symptoms, but that's not where I want to go anyway. Um, uh, there are many different things, factors that cause a disease, many different factors. So you have a initiating causal factor that come in. Then you have B, C, D, E, F, and G, and multiple more of conditions. So the cause of any disease is cause and conditions. Cause and conditions. That's very significant. So if you identify what the cause is, okay, and you can enhance some of the conditions around it that we say causes a disease, will not cause a disease. Okay? So, with viruses, we want to strengthen the factors that are around the virus so it does not cause a disease state. Now, one of the big things that causes diseases is your belief that it causes diseases. That's very primary. And I'm going to say this from multiple levels of society, including our wonderful media. They do a great job in many ways, but at the same time, perhaps to promote, sales of the newspapers, etc., that they, and also the culture is, responding to certain elements of the culture, because not everybody in the culture is like this, but they respond to certain elements of the culture of the worst possible thing and fear, and look at the bad numbers, look at the bad outcome. Two different things you can say about this virus. Wow, look at the bad outcome, many deaths, the deaths that have been caused. Look at the numbers, and you can say, wow, look at the amount of people who have the disease but are not getting the disease. Now, in this particular instance, and I'm going to say in all instances, both of those are important, and neither should be ignored. Both of those are important, and neither should be taken lightly, or just concentrated on only one segment of it. All of that's important, all right? Now, I'm going to say something else that you may not want to hear about viruses, but I have to say it to you. Below are links for you to get more information on audio and book forms to maximize your health, and information on nutrients to empower your body to better deal with life.